Hi, thank you for taking the time to click on this video today. We are excited for you that you are looking at this new journey of finding support for your mental health. And we do know that there's so many options that sometimes it's a bit confusing. So we wanted to offer you some support in making those decisions for yourself. So let's talk about the different levels of care within the mental health spectrum. It starts off really with what you're probably most familiar with, which is outpatient counseling. So this is your traditional once a week, every other week, maybe monthly individual counseling sessions with a local provider. And so this is for someone who has some mild symptoms, maybe needs a little bit more support in stabilizing, but mostly can manage in their day-to-day life. And so you might find yourself there. However, you also may find I need more support than that. And the good news is there's care for that too. So we have intensive outpatient counseling, sometimes called IOP. And that's for someone whose symptoms are a little bit more than they're able to manage in their usual day. And so maybe you're having some trouble at work or at home in relationships, and your symptoms need a little bit more than what you can get in a weekly outpatient session for about 50 minutes. And so we're here to support that need. We also have partial hospitalization program. That's a step up from the IOP. It's more intense, and this is someone who's really struggling to the degree that if I don't get help, I probably will end up in acute hospitalization or maybe even a residential inpatient placement. And so there are supports for that too. Now, if you find yourself in imminent danger or harm, maybe even having some suicidal thoughts, those are things that you can have an immediate resource for. So there are places where you can get acute treatment, maybe your local ER or even a mental health emergency care location. So those are options as well. And then the highest level of care is residential placement. And so within the residential treatment center placement, that's for individuals who really need 24-hour monitoring. And so you are not in your home setting, but in a facility where they can provide you the ongoing support that you need. And so with all that being said, there are lots of things to choose from. The good thing is we're here to help you with that.